Last but not least, ladies and gentlemen, we have for you Dr. Jimmy Lim, ophthalmologist at Gleneagles Hospital. Now, Dr. Jimmy Lim is an ophthalmologist and an eye surgeon practicing at Gleneagles Hospital, Singapore. Now, he specializes in cataract surgery, refractive surgery, also known as LASIK, cornea disease treatment, and general ophthalmology. Now, prior to setting up his private practice, Dr. Lim was a senior consultant and deputy head of cornea and refractive surgery at the National Healthcare Group Eye Institute at Tan Tock Seng Hospital, providing quality eye care to both local and foreign patients for over 17 years. So, ladies and gentlemen, we're very lucky to have Dr. Jimmy Lim today. Dr. Jimmy, now we can hand over the stage to you.
Thank you. Thanks for having me here today. And thanks for spending the afternoon with me. Shall we begin? Yep. So today we are going to talk about see well, live well, eye health for everyone. This is my clinic. Well, here are my previous training places. I was in Texas for a moment, and taking care of sportsmen, astronauts alike, and of course in Switzerland as well, where I was doing some of my training as well. Okay. So one of the most common symptoms that I have in my clinic is that the eyes are tired and burning and tearing. And this is one of the most common diseases that I see on a daily basis, dry eye diseases. Common diseases and the symptoms includes tired eye, stinging and burning sensation with an intermittent blurring of vision. And sometimes it's so bad that the vision can be affected, causing poor vision and constant discomfort, which is terrible. I'll show you a photo of a person with very bad dry eyes and severe irregularity on the surface of the eye. This affected a person's vision. With treatment, as you can see, the tear film becomes regular and smooth, and the vision has improved. Here's a video of a person with a very dry eyes. You can see how uncomfortable the patient is by the constant blinking the person is experiencing. And imagine someone looking at you and blinking all the time. And with treatment, you can see the blinking becomes back to normal. You hardly see the blinking in the patient's eye. So what are risk factors of dry eyes that you can help yourself with? Hydrate. Drink lots of water. Long hours on screen. I know we can't help it, but please take a break in between the screen. Adequate sleep is a little bit need to be overemphasized because this is something that we don't do very much. Environmental pollution. Medications. Some medications such as antihistamines, antidepressants, they can actually cause dry eyes, and sometimes autoimmune diseases and inflammatory diseases. There are many eye drops around over the counters and in doctors' offices for anti-inflammatories, dry eyes. But which one do you choose? I just want to show you that currently with technology, some positively charged tear film like this, when it drops in the eye, spreads very evenly. But normal eye drops, they tend to perch on top of the eye. So you can see that there's better spread if you choose different type of eye drops. So different eye drops actually do different things. And one of the things that I see very often in my clinic is patients coming saying that I see mosquitoes flying in my vision. I see dust particles floating about. And sometimes I'm catching and I can't find them. I think many patients actually experience this in your vision. When you look up at the clear blue sky, you see these black spots in the sky, and also all these worms that's floating in your eyes. What are floaters? Actually, it's found in aging and myopic eye. Liquefaction and detachment of the vitreous gel is generally harmless, but it needs to be checked because sometimes it may be bleeding in your eyes, retina tears, and detachment. So I always advise patients to come and see the doctor. Here is a photo of how it looks like. As you can see, as the gel pulls on the retina, sometimes it causes a tear or break. And you can see that there's all these little wriggly lines in the gel that's floating around your eye. That is what you call floaters. So can it be treated? That's the most common questions patients ask me. Well, I would always tell them treatment is definitely unnecessary unless there's associated retinal tears, break, or vitreous hemorrhage. So really just monitor the symptoms, look for any worsening of symptoms such as worsening of floaters and flashes, or decreased vision. And you need to see an ophthalmologist as soon as possible. Here are some photos of retinal tears and detachment seen in patient's eye. But more often than not, floaters is quite benign. Usually they are not associated with any tears or breaks. The next thing, a lot of families come and ask me, and parents come and ask me, I have a family history of myopia. Will my child have myopia? So myopia is a condition where you can see near objects clearly and distant objects poorly. And it affects about 75% of age between 15 to 19 years old. I'm myopic myself, so it's very common in Singapore. So the myopic eye is because the eyeball is longer and the light focuses in front of the retina. That's why you need to wear spectacles to push the light back to the retina. But what are the symptoms in a child if the child is developing myopia? Persistent squinting, needing to sit closer and closer to the television, unaware of distant object, excessive bleeding, and frequent rubbing of the eye. So why do we have to prevent myopia? Just wear spectacles. What's the big deal? Well, high myopia can result in retina thinning and tears and breaks and glaucoma, as in this patient. So early cataract and inconvenience of wearing spectacles and contact lenses. Can we prevent it? Yes, we can prevent myopia by having the kid playing more often outdoors and getting exposed to the sun. Go to an optometrist, get the child checked, and give him corrective prescription if the glasses is required. The strategy to prevent myopia is to prevent the axial length from getting longer. So now we have very effective medications such as atropine to be used in children's eye to prevent the axial length from getting longer and longer. So we use laser to measure the patient's eye to see how long the eyeball is to monitor them. There are other accessories out there such as Hoya lenses. But what I don't recommend to patients is to use auto-K to correct the cornea at night when they sleep, and tomorrow morning they don't need to wear spectacles. So another one is, I have a family history of glaucoma. What is glaucoma? Glaucoma is when there's an increased pressure of the eye causing damage to the optic nerve. It's a disease of progressive damage to the optic nerve, and it's a blinding condition. It may be associated with high pressure. But what are the symptoms? Well, unfortunately, majority no symptoms. They are unaware of gradual visual loss until very late. And unfortunately, it's irreversible. As you can see in this photo, there is a progression of the glaucoma from a normal nerve to a nerve that is very big. And this is a photo of a patient with glaucoma. And what happens is the vision becomes a tunnel vision. The peripheral vision is all lost, and all they can see is the central vision, something like this. So glaucoma is usually diagnosed on a routine examination or screening. So when do we screen? We screen when you have a family history of glaucoma, age above 40, history of eye injury, or chronic use of steroids. There are many modern diagnostics that we use. These are some examples of how we check the pressure in a patient's eye. We use machines such as these to look at the fiber thickening of the retina around the optic nerve to suggest whether patients have glaucoma or not. Like in this case, there's thinning of the nerve, and we found that patient has glaucoma. This is a visual field that we do for a patient with normal visual field, and a glaucoma patient would have a visual field that looks like that with a lot of darkening around the visual field. So how do we treat glaucoma? We can use medication, we can use laser, and we can use surgery. Medications are very effective now, and hardly patients need to go for surgery nowadays. And sometimes we use laser to increase the channel of flow in the eye, and sometimes we insert small little stent in the patient's eye to allow the fluid to flow, such as this. So another one is I have difficulties recognizing faces. One of the other common complaints I've seen in patients, I have progressive blurring of vision. To understand this, you need to understand where the lens in the normal eye is, just like the spectacles. This is a lens that's clear. There is no cataract in this patient's eye. So what is cataract? And why am I showing photos of waterfall? Because cataract derives from the word waterfall in Latin. And you can see in this case, it doesn't need a doctor to diagnose that this patient has a very dense cataract. And this person has a very dense central cataract causing changes in the power of the eye. And an 80-year-old lady that I saw this morning also had a cataract that looks like this. It's a very dense cataract in the upper arms cataract, I call them. And however, some steroid-using cataract or cataracts from inflammation and trauma. You can have a posterior subcapsular cataract that occur in patients as young as 30 years old. And this patient is about 42 years old with a history of injury. So when do we need surgery? We need surgery when your vision is affected, your daily life is affected. You can't see the bus number, have difficulty crossing the road, and any of these other activities that you love to do and can't do because of poor vision. In ancient history, the Egyptians just used a needle and poke right through the person's eye and drop the lens to the back. However, it doesn't solve the problem, because currently what we can do is we insert lens to give you spectacles-free vision. There are many types of refractive error. We can correct for myopia, hyperopia, astigmatism, and even presbyopia. So what has it got to do with this aeroplane, the Spitfire in World War I? Because of the Spitfire during World War I, the acrylic that entered the patient's eye was found to be inert in the person's eye. And it was discovered by Sir Harold Ridley, and he invented the first intraocular lens. So intraocular lens is a big deal, and it helps us correct for vision for far and intermediate, known as monofocal lenses, astigmatic lenses that correct astigmatism at the same time, presbyopic lenses, trifocal lenses, such as EDOF lenses, such as this person. You can see that without the reading abilities, it's going to be on the right. With the reading ability, you can still see the menu on the left with EDOF lenses. And there are also multifocal lenses that are in use currently as well. The difference between is about the halos and the glare. Multifocality allows you to read better than EDOF lenses, but EDOF lenses have less halos and glares. Such as this, when you're driving, you can see the distance, you can see the intermediate, and you can also read your phone at the same time, though it's not recommended. How you choose the lens power? Well, it's an art and a science. It's a little bit like customized vision correction, where we measure in the tailor shop, how do we put inside the person's eye and the power. We have a whole suite inside the clinic just to measure patients' vision. And it's customized measurement of the eye using machines to check for how steep the cornea is, how deep the lens is, and how long the eyeball is. This is what we do. We also use topographic map to look at the cornea surface, to look at how steep the cornea is and how much astigmatism that we need to correct for the patient, such as this. So the cataract surgery is undergoing phacoemulsification. It's very fast. We do a surgery in about 15 to 20 minutes. And many patients have benefited from cataract surgery. So choose a well-experienced and a well-trained surgeon for your cataract surgery. And you have a good outcome if the cataract surgery is done smoothly. Such as a multifocal lens in the patient's eye. A multifocal lens allows you to see for far, intermediate, and near at the same time. And this patient has astigmatic correction at the same time. And this is a monofocal lens allowing patients to see far and intermediate. And to summarize, the take-home message today for you is, your eyes are vital to your well-being. Some symptoms, though trivial, may look serious problems. There are rapid advances in the technology in eye and ophthalmology, and most parts, prevention is better than cure. So do consider regular eye screening. You can visit our blog for more information. And with that, I thank you for your time today. Thank you.